When reviewing the health history of a patient, the nurse will note that a potential contraindication to potassium supplements exists if the patient has which problem? A burns, B. Diarrhea, C. Renal disease, D. Cardiac tachyarrhythmias. Answer: C. Renal disease. Rationale: potassium supplements are contraindicated in the presence of renal disease. The other conditions listed may be treated with potassium supplements. During diuretic therapy, the nurse monitors the fluid and electrolyte status of the patient. Which assessment findings or symptoms of hyponatremia? Select all that apply. A red, flushed skin, B. Lethargy, C. Decreased urination, D. Hypotension, E. Stomach cramps, F. Elevated temperature. Answer: B. Lethargy, D. Hypotension, E. Stomach cramps. Rationale: hyponatremia is manifested by lethargy, hypotension, stomach cramps, vomiting, diarrhea, and seizures. The other options are symptoms of hypernatremia. The nurse is preparing to give a potassium supplement. Which laboratory test should be checked before the patient receives a dose of potassium? A complete blood count, B. Serum potassium level, C. Serum sodium level, D. Liver function studies. Answer: B. Serum potassium level. Rationale: contraindications to potassium replacement products include hyperkalemia from any cause. It is important to know the patient's electrolyte levels before beginning electrolyte replacement therapy. Giving potassium supplements to a patient whose serum potassium levels are already high may cause worsening of the hyperkalemia. The other options are incorrect. A patient who is severely anemic also has acute heart failure with severe edema due to fluid overload. The prescriber wants to raise the patient's hemoglobin and hematocrit levels. The nurse anticipates that the patient will receive which blood product? A fresh frozen plasma, B. Albumin, C. Packed red blood cells, PRBCs, D. Whole blood. Answer: C. Packed red blood cells, PRBCs. Rationale: PRBCs are given to increase the oxygen carrying capacity in a patient with anemia, in a patient with substantial hemoglobin deficits, and in a patient who has lost up to 25% of total blood volume. A patient with a coagulation disorder or a clotting factor deficiency would receive fresh frozen plasma. A patient who has lost a massive amount of blood would receive whole blood. After a severe auto accident, a patient has been taken to the trauma unit and has an estimated blood loss of more than 30% of his blood volume. The nurse prepares to administer which product? A. Albumin, B. Whole blood, C. Packed red blood cells, D. Fresh frozen plasma. Answer: B. Whole blood. Rationale: a patient who has lost a massive amount, over 25%, of blood volume would receive whole blood. PRBCs are given to increase the oxygen carrying capacity in patients with anemia, in patients with substantial hemoglobin deficits, and in patients who have lost up to 25% of their total blood volume. A patient with a coagulation disorder or a clotting factor deficiency would receive fresh frozen plasma. Albumin is used to expand fluid volume. The nurse is preparing to transfuse a patient with a unit of packed red blood cells, PRBCs. Which patient would be best treated with this transfusion? A. A patient with a coagulation disorder. B. A patient with severe anemia. C. A patient who has lost a massive amount of blood after an accident. D. A patient who has a clotting factor deficiency. Answer: B. A patient with severe anemia. Rationale: PRBCs are given to increase the oxygen carrying capacity in patients with anemia, in patients with substantial hemoglobin deficits, and in patients who have lost up to 25% of their total blood volume. Patients with coagulation disorder or clotting factor deficiency would receive fresh frozen plasma. A patient who has lost a massive amount of blood would receive whole blood. The nurse is preparing to transfuse a patient with a unit of packed red blood cells, PRBCs. Which intravenous solution is correct for use with the PRBC transfusion? A 5% dextrose in water, B5W, B0.9% sodium chloride, NS, C5% dextrose in 0.45% sodium chloride, D5NS, D5% dextrose in lactated Ringer's solution, D5LR. Answer: B0.9% sodium chloride, NS. Rationale: blood products should be given only with normal saline 0.9% because D5W will also cause hemolysis of the blood product. A patient is receiving an infusion of fresh frozen plasma. Based on this order, the nurse interprets that this patient has which condition? A hypovolemic shock, B anemia, C coagulation disorder, D previous transfusion reaction. Answer: C coagulation disorder. Rationale: fresh frozen plasma is used as an adjunct to massive blood transfusion in the treatment of patients with underlying coagulation disorders. The other options are not indications for fresh frozen plasma. During an infusion of albumin, the nurse monitors the patient closely for the development of which adverse effect? A hypernatremia, B fluid volume deficit, C fluid volume overload, D transfusion reaction. Answer: C fluid volume overload. Rationale: during the infusion of albumin, the development of fluid volume overload must be monitored by the nurse, especially in those at risk for heart failure. The other options are incorrect. When monitoring a patient for signs of hypokalemia, the nurse looks for what early sign? A seizures, B cardiac dysrhythmias, C diarrhea, D muscle weakness. Answer: B muscle weakness. Rationale: muscle weakness is an early symptom of hypokalemia, as are hypotension, lethargy, mental confusion, and nausea. Cardiac dysrhythmias are a late symptom of hypokalemia. The other options are incorrect. A patient is in an urgent care center and is receiving treatment for mild hyponatremia after spending several hours doing gardening work in the heat of the day. The nurse expects that which drug therapy will be used to treat this condition? A. Oral supplementation of fluids. B. Intravenous bolus of lactated Ringer's solution. C. Normal saline infusion. Administered slowly. D. Oral administration of sodium chloride tablets. Answer: D. Oral administration of sodium chloride tablets. Rationale: mild hyponatremia is usually treated by oral administration of sodium chloride tablets. Pronounced sodium depletion is treated by intravenous normal saline or lactated Ringer's solution. The nurse is working with a graduate nurse to prepare an intravenous dose of potassium. Which statement by the graduate nurse reflects a need for further teaching? A. We will need to monitor this infusion closely. B. The infusion rate should not go over 10 MEq per hour. C. The intravenous potassium will be diluted before we give it. D. The intravenous potassium dose will be given undiluted. Answer: D. The intravenous potassium dose will be given undiluted. Rationale: when giving intravenous potassium, the medication must always be given in a diluted form and administered slowly. Intravenous bolus or undiluted forms may cause cardiac arrest. Intravenous rates are not to exceed 10 MEq per hour unless the patient is on a cardiac monitor. Oral forms should be mixed with juice or water or taken according to instruction. During a blood TR transfusion, the patient begins to have chills and back pain. What is the nurse's priority action? Observe for other symptoms. B. Slow the infusion rate of the blood. C. Discontinue the infusion immediately and notify the prescriber. D. Tell the patient that these symptoms are a normal reaction to the blood product. Answer. C. Discontinue the infusion immediately and notify the prescriber. Rationale. Because of the possibility of a TR transfusion reaction, the infusion should be discontinued immediately. And the prescriber notified. The intravenous line should be kept patent with isotonic normal saline solution infusing at a slow rate. And the healthcare institution's protocol for TR transfusion reactions should always be followed. The other options are inappropriate actions. A patient who has an NPO order after surgery is receiving intravenous fluid replacement. The nurse assesses this patient for which of the following signs of mild or early dehydration as one indicator of overall fluid status. 1. Increased thirst. 2. Very dry mouth. 3. Increased pulse rate. 4. Scant urine output. Answer. 1. Increased thirst. Rationale. Increased thirst is a sign of early or mild dehydration, usually associated with a 2% loss in body weight. Signs of moderate to severe dehydration include very dry mouth, difficulty swallowing, scant urine output, increased pulse and temperature, poor skin turgor, and an approximate 6% loss in weight. The nurse understands that fluid shifts into the intracellular fluid because of dehydration is accomplished by which of the following TR transport mechanisms in the body? 1. Osmosis. 2. Diffusion. 3. Active TR transport. 4. Gravity. Answer. 1. Osmosis. Rationale. Water travels from less concentrated areas to areas with higher concentrations of solutes or dissolved substances by osmosis. Which of the following patients has the least immediate need for intravenous therapy as a answer of fluid replacement? 1. A patient with abnormalities of serum sodium and potassium levels. 2. A patient in diabetic ketoacidosis. 3. A patient who is having an electrocardiogram. 4. A patient who is dehydrated with loss of consciousness. Answer. 3. A patient who is having an electrocardiogram. Rationale. Intravenous solutions are infused for various therapeutic reasons, including to replace fluids and electrolytes. Correct acid-base imbalances, administer medications and diagnostic aids, and to administer essential nutrients in a patient who cannot take them orally. The patient with hypernatremia has intravenous fluid therapy ordered. The nurse selects which of the following solutions from the storage area as ordered on the physician's order sheet. 1. 5% dextrose in 0.45% sodium chloride. 2. 5% dextrose in 0.9% sodium chloride. 3. 5% dextrose in 0.225% sodium chloride. 4.5% dextrose in water. Answer. 4.5% dextrose in water. Rationale. Treatment for hypernatremia includes reducing salt intake and using intravenous dextrose in water to promote diuresis and increase the excretion of both salt and water from the blood. A patient is about to undergo a diagnostic bowel procedure. The nurse expects which drug to be used to induce total cleansing of the bowel. A. Polyethylene glycol, golightly. B. Docusate. C. Mineral oil. D. Milk of magnesia. Answer. A polyethylene glycol, golightly, rationale. Polyethylene glycol is a very potent laxative that induces total cleansing of the bowel and is most commonly used before diagnostic or surgical bowel procedures. A patient will be taking bismuth subsalicylate, Pepto-Bismol, to control his diarrhea. When reviewing the patient's other ordered medications, the nurse recognizes that which medication will interact significantly with the Pepto-Bismol. A. Digoxin, Lanoxin, B. Antacids, C. Acetaminophen, Tylenol, D. Tricyclic antidepressants. Answer. A. Digoxin, Lanoxin. Rationale. Taking digoxin with an adsorbent such as bismuth subsalicylate may result in decreased absorption of the digoxin. The other options are not correct. When administering a bulk-forming laxative, the nurse instructs the patient to drink the medication mixed in a full 8-ounce glass of water. Which statement best explains the rationale for this instruction? A. There will be fewer systemic effects. B. The water will help to reduce the bulk of the intestinal contents. C. These laxatives may cause esophageal obstruction if taken with insufficient water. D. The water acts as a lubricant to produce bowel movements. Answer. C. These laxatives may cause esophageal obstruction if taken with insufficient water. Rationale. Bulk-forming drugs increase water absorption, which results in greater total volume, bulk, of the intestinal contents. Bulk-forming laxatives tend to produce normal, formed stools. Their action is limited to the gastrointestinal tract, so there are few, if any, systemic effects. However, they should be taken with liberal amounts of water to prevent esophageal obstruction and fecal impaction. The nurse is giving oral mineral oil as an ordered laxative dose. The nurse will take measures to prevent which potential problem that may occur with mineral oil? A. Fecal impaction. B. Constipation. C. Lipid pneumonia. D. Esophageal blockage. Answer. C. Lipid pneumonia. Rationale. Lipid pneumonia may occur if the oral mineral oil is accidentally aspirated into the respiratory tract. The other options are not correct. The nurse is providing teaching to a patient who will be taking the laxative docusate, Basacadil. Which statement by the nurse is appropriate during this teaching session? A. The tablets may be crushed to improve action. B. The tablets should be taken with water. C. Do not take laxatives if you are experiencing vomiting or abdominal pain. D. In a normal bowel pattern, a bowel movement occurs daily. Answer. B. The tablets should be taken with water. Rationale. Docusate should be given with water only because interactions with milk and antacids may occur. All laxative tablets should be swallowed whole. A normal bowel pattern does not necessarily mean one bowel movement a day. A client who takes an antihypertensive drug at 0900 has a new drug order for an antacid 3 times daily. When scheduling the morning dose, the nurse should select which of the following times as optimal: 1. 0702, 0803, 0904, 1000. Answer. 2. 0800. Rationale. Antacids have been reported to reduce the absorption of many drugs. Therefore, carefully schedule the majority of medications 1 hour before or 2 hours after the administration time for an antacid. The nurse PL answer to assess a client taking an antacid containing aluminum for which of the following adverse effects? 1. Diarrhea. 2. Constipation. 3. Gastrointestinal upset. 4. Ulcers. Answer. 2. Constipation rationale. Aluminum and calcium containing antacids lead to constipation, whereas magnesium containing antacids lead to diarrhea. A client receiving intravenous fluid therapy starts to exhibit dyspnea on exertion and a cough. Pulse rate is increased and lung crackles are auscultated. The nurse should take which of the following initial actions? 1. Prepare a dose of potassium in anticipation of this order. 2. Slow the intravenous infusion to a keep vein open rate. 3. Remove the intravenous catheter. 4. Assist the client to lie in bed with the head flat. Answer. 2. Slow the intravenous infusion to a keep vein open rate. Rationale. Pulmonary edema occurs when the circulatory system is overloaded with fluids. Slow the infusion to a keep vein open (KVO) rate to provide access for emergency medications. Oxygen can be started to improve gas exchange. Monitor vital signs every 15 to 30 minutes as well as intake and output and arterial blood gas results. The nurse would conclude that a client was successfully treated for hypomagnesemia after noting which of the following values on a laboratory report. 1. 0.8 MEq per deciliter. 2. 1.0 MEq per deciliter. 3. 1.9 MEq per deciliter. 4. 2.8 MEq per deciliter. Answer. 3. 1.9 MEq per deciliter. Rationale. Normal serum concentration is 1.5 to 2.5 MEq/L, with 1/3 bound to protein and 2/3 free. The nurse has an order for 1 liter, 1000 milliliters, 5% dextrose and 0.45% sodium chloride with 20 MEq/L of potassium chloride to be administered to an older adult who is being admitted from the emergency department. The nurse would do which of the following at this time? 1. Question the potassium order. 2. Question the intravenous order. 3. Request an infusion pump. 4. Request an order for a cardiac telemetry bed. Answer. 3. Request an infusion pump. Rationale. Potassium infusions must always be administered by a controller or pump to prevent rapid infusion. Cardiac monitoring is not necessary unless it is greater than 40 MEq/L. The intravenous solution and potassium order are acceptable and do not require questioning. A client taking spironolactone, aldactone, has been taught about the therapy. Which menu selection indicates that the client understands teaching related to this medication? A. Apricots. B. Bananas. C. Fish. D. Strawberries. Answer. C. Fish. Rationale. Spironolactone is a potassium-sparing diuretic that could potentially cause hyperkalemia. Fish is an appropriate dietary choice because it is low in potassium. The other foods are high in potassium. The nurse would assess for which of the following in a client suspected of having hypokalemia? 1. Hypertension. 2. Irritability. 3. Tetany. 4. Weakness. Answer. 4. Weakness. Rationale. Symptoms of hypokalemia include impaired muscle function manifested in such ways as profound weakness or paralysis, including paralysis of the respiratory muscles and ileus. A nurse admits a client diagnosed with pneumonia. The client has a history of chronic renal insufficiency, and the healthcare provider orders furosemide, Lasix, 40 mg twice a day. What is most important to include in the teaching plan for this client? A. That the medication will have to be monitored very carefully owing to the client's diagnosis of pneumonia. B. The fact that Lasix has been proven to decrease symptoms with pneumonia. C. The fact that Lasix has shown efficacy in treating persons with renal insufficiency. D. That the medication will need to be given at a higher than normal dose owing to the client's medical problems. Answer: C. The fact that Lasix has shown efficacy in treating persons with renal insufficiency. Rationale: furosemide is effective in clients with creatinine clearance as low as 25 L per minute, normal 125 L per minute. The nurse is assessing a client who is taking furosemide, Lasix. The client's potassium level is 3.4 meq/L, chloride is 90 mmol/L, and sodium is 140 meq/L. What is the nurse's primary intervention? A. Mix 40 meq of potassium in 250 ml D5W and infuse rapidly. B. Administer Electrolyte. C. Administer 2 meq potassium chloride per kilogram per day IV. D. Administer Foslo, 2 tablets 3 times per day. Answer: C. Administer 2 meq potassium chloride per kilogram per day IV. Rationale: furosemide is a potent loop diuretic, resulting in the loss of potassium as well as water, sodium, and chloride. The client needs chloride replacement. What is the best information for the nurse to provide to the client who is receiving spironolactone, aldactone, and furosemide, Lasix therapy? A. Moderate doses of 2 different diuretics are more effective than a large dose of one. B. This combination promotes diuresis but decreases the risk of hypokalemia. C. This combination prevents dehydration and hypovolemia. D. Using 2 drugs increases the osmolality of plasma and the glomerular filtration rate. Answer: B. This combination promotes diuresis but decreases the risk of hypokalemia. Rationale: spironolactone is a potassium-sparing diuretic. Furosemide causes potassium loss. Giving these together minimizes electrolyte imbalance. Which laboratory value will the nurse report to the healthcare provider as a potential adverse response to hydrochlorothiazide, hydrodiurol? A. Sodium level of 140 meq/Lb. Fasting blood glucose level of 140 mg per deciliter C. Calcium level of 9 mg per deciliter D. Chloride level of 100 meq/L. Answer: B. Fasting blood glucose level of 140 mg per deciliter. Rationale: hydrochlorothiazide, hydrodiurol, can cause hyperglycemia. Which position order would the nurse question when administering IV fluids with potassium chloride, KCl? 1. Inject IV KCl directly into the IV tubing. 2. Check for infiltration because potassium is irritating to subcutaneous tissues. 3. Check for phlebitis because potassium is irritating to the veins. 4. Check for adequate urinary output. Kidney dysfunction can cause potassium retention that may lead to hyperkalemia. Answer: 1. Inject IV KCl directly into the IV tubing. Rationale: KCl should never be directly injected, but must be diluted so that it will not cause venous or tissue damage or more serious effects of a large bolus, such as cardiac standstill. The nurse is aware that which groups of drugs contains magnesium and can cause hypermagnesemia if taken in excess? 1. Laxatives and steroids. 2. Laxatives and antacids. 3. Antacids and antibiotics. 4. Antacids and steroids. Answer: 2. Laxatives and antacids. Rationale: laxatives and antacids may contain magnesium and have the potential for misuse in clients. When assessing a patient who is about to receive an albumin infusion, Which of these conditions must a nurse recognize as a possible contraindication to albumin infusion? Select all that apply. A. Pancreatitis B. Heart failure C. Severe burn D. Renal insufficiency E. Fluid volume deficit. Answer. B. Heart failure D. Renal insufficiency rationale. The given example presents a patient who is to receive albumin infusion. Albumin infusion is not contraindicated for acute liver failure, and in fact, this therapy is provided for cirrhosis condition. Hence, the option A is incorrect. Albumin infusion therapy also is not contraindicated for heart failure. Hence, the option C is incorrect. The fluid volume deficit is not a condition which is contraindicated for albumin infusion therapy. Hence, the option D is incorrect. Albumin therapy is provided to restore or maintain the osmotic pressure of plasma. This treatment is contraindicated in patients with heart failure. When preparing an IV solution that contains potassium, which of these conditions must a nurse recognize as a contraindication to the potassium infusion? A. Diarrhea B. Serum sodium level of 145 MEq, LC. Serum potassium level of 5.6 MEq, LD. Dehydration. Answer. C. Serum potassium level of 5.6 MEq, L. Rationale. The given example presents a situation that warrants intravenous infusion of potassium solution. Such an infusion is not contraindicated if the patient has diarrhea. Hence, the option A is incorrect. The normal sodium level range in the serum is 135 to 145 MEq, L, and hence, this level is not contraindicated for IV potassium infusion. Hence, the option B is incorrect. Dehydration also is not one of the conditions which is contraindicated for potassium infusion. Hence, the option D is incorrect. The normal serum potassium levels range from 3.5 to 5.0 MEq, L. Hence, a serum potassium level of more than 5.0 MEq, L is contraindicated for IV infusion of potassium. Which action by the nurse is most appropriate for the patient receiving an infusion of packed red blood cells? A. Flush the IV line with normal saline, NS, before the blood is added to the infusion. B. Flush the IV line with dextrose before the blood is added to the infusion. C. Check the patient's vital signs after the infusion is completed. D. Anticipate that flushed skin and fever are expected reactions to a blood TR answer fusion. Answer. A. Flush the IV line with normal saline, NS, before the blood is added to the infusion. Rationale. Intravenous infusion of packed red blood cells is performed for a variety of reasons. One of the appropriate nursing actions while infusing packed red blood cells is to flush the IV line with normal saline and not dextrose. Hence, the option B is incorrect. The most appropriate nursing action when a patient is about to receive IV infusion of packed red blood cells is to prepare the IV line before infusion and not in monitoring the patient's vital parameters after the infusion. Hence, the option C is incorrect. A successful blood TR answer fusion which is properly matched should not result in any signs or symptoms such as flushed skin or fever. Hence, the option D is incorrect. The IV line that is being used for TR answer fusion of packed red blood cells should be flushed with normal saline before the infusion begins. Which of the following outcomes would be appropriate for the patient receiving patiromer? A. Increased serum sodium B. Decreased serum potassium C. Increased serum magnesium D. Decreased serum calcium. Answer. B. Decreased serum potassium. The nurse would anticipate the administration of which of the following in the patient with a potassium level of 5.9 MEq? A. Furosemide. B. Sodium chloride. C. Magnesium sulfate. D. Sodium polystyrene sulfonate. Answer. D. Sodium polystyrene sulfonate are common uses of crystalloids. Select all that apply. A. Fluid replacement. B. Promotion of urinary flow. C. Transport of oxygen to cells. D. Replacement of electrolytes. E. As maintenance fluids. F. Replacement of clotting factors. Answer. A. Fluid replacement. B. Promotion of urinary flow. D. Replacement of electrolytes. E. As maintenance fluids, the patient is about to receive a dose of the non-protein plasma expander, dextran. The nurse knows that this product is indicated for which type of blood loss? A. Slow loss of 20% or less. B. Slow loss of 20% to 50%. C. Slow loss of over 50% or acute loss of 20%. D. Loss of 80% or more. Answer. B. Slow loss of 20% to 50%. The nurse is administering an IV solution that contains potassium chloride to a patient in the critical care unit who has a severely decreased serum potassium level. Which actions by the nurse are appropriate? Select all that apply. A. Administer the potassium by slow IV bolus. B. Administer the potassium at a rate no faster than 20 MEq per hour. C. Monitor the patient's cardiac rhythm with a heart monitor. D. Use an infusion pump for the administration of IV potassium chloride. E. Administer the potassium via IV pus. Answer. B. Administer the potassium at a rate no faster than 20 MEq per hour. C. Monitor the patient's cardiac rhythm with a heart monitor. D. Use an infusion pump for the administration of IV potassium chloride. While monitoring a patient who is receiving an infusion of a crystalloid solution, the nurse will monitor for which potential problem? A. Bradycardia. B. Hypotension. C. Decreased skin turgor. D. Fluid overload. Answer. D. Fluid overload. A patient is receiving conivaptan. Which action by the nurse is appropriate? A. Administer the drug by slow IV push over 10 minutes. B. Report serum sodium levels of 149 MEq, L. C. Monitor for hyperkalemia. D. Implement measures to prevent constipation. Answer. B. Report serum sodium levels of 149 MEq. Administration of a hypertonic intravenous fluid would result in which of the following? A. Cellular shrinkage. B. Cellular swelling. C. Dependent edema. D. Dehydration. Answer. A. Cellular shrinkage. The nurse monitors for which signs of a possible TR-answer fusion reaction when a patient is receiving blood products. A. Subnormal temperature and hypertension. B. Apprehension, restlessness, fever, and chills. C. Decreased pulse and respirations and fever. D. Headache, nausea, and lethargy. Answer. B. Apprehension, restlessness, fever, and chills. A patient with a blood disorder needs a replacement product that contains clotting factors. The nurse expects which product to be given? A. Albumin. B. Fresh frozen plasma. C. Packed red blood cells. D. 0.9% normal saline. Answer B. Fresh frozen plasma. Which of the following client groups is most at risk for dehydration because of reduced thirst? 1. Adolescents. 2. Young adults. 3. Middle adults. 4. Older adults. Answer 4. Older adults.